We all need clear sight to be able to appreciate nature and the creations of God, like this one. At the same time, we need to be careful so that they do not harm our eyes. You're welcome to today's edition of Sight It, a sight educational program designed to enlighten each and every one of us about eye health issues. Today we're going to be talking about a disease that is often dreaded because it is a cause and the commonest cause of irreversible blindness. Glaucoma, the silent thief of sight, that is the disease we'll be talking about today. This disease is often painless, progressive, and oftentimes do not show any sign until almost all the vision have been taken away. That's why you and I need to know all we need to know about glaucoma so that we can take control and prevent this silent thief of sight from taking our vision away. We have interviewed for this episode a professor of ophthalmology, a specialist in this field, Professor Victoria Pam, who will be talking to us about what is glaucoma. What are the causes of glaucoma? And more importantly, what can you and I do to ensure that we do not become a victim of glaucoma? Thank you.
I'm Professor Mrs. Victoria Pam. I work in the Department of Ophthalmology, Ahmadu Bello University Teaching Hospital in Zaria. Glaucoma is a group of eye disorders or disease that affect the vision of the eye. It causes irreversible blindness if left untreated. However, glaucoma as a disease does not come with pain. It does not come with redness, but gradually the vision keeps disappearing, as it were. It cannot be cured, but it can be controlled so that it does not progress to blindness. There are different types of glaucoma, but the most common type of glaucoma we see in our environment is the chronic open-angle glaucoma. And this type of glaucoma, as I've said, does not come with pain. It does not come with redness, but gradually the vision keeps disappearing, as it were. If left untreated, it results in blindness. We can only control the progression of this disease, but we cannot cure it. So this means that individuals with this type of condition needs to be seen early in the disease in order to reduce the progression to blindness. Glaucoma is the second common cause of blindness worldwide, second to cataract. Cataract actually is quite different from glaucoma. Cataract, with surgical intervention, vision can be restored back to normal. However, glaucoma, once the vision is lost, there is nothing anybody can do to restore back the vision. Symptom of the most common type of glaucoma, the open-angle glaucoma or primary open-angle glaucoma. It is symptomless. However, a few may present with blurring of vision for both distance and even for reading. Some may present with aches in the eye. Some may also present with frequent changes in their reading glasses. Instead of changing glasses in 2 years, probably the individual may visit the optometrist 2 or 3 times in a year for a change of glasses. Glaucoma, as I said, does not come with symptom, no pain, and there is no redness. But gradually the vision gets contracted until the individual is unable to move around by himself or herself. There are different methods of approach. All we do in the treatment of glaucoma, once the diagnosis is made, is to inform the individual that he or she will need treatment for life. Therefore, we advocate, or rather we encourage, regular follow-up. Glaucoma can be treated or can be controlled by drugs, eye medications. Often I have seen individual patients on medications instilled in the eye who may not use their drugs until they're coming to the hospital. When this is done, it actually does not help the individual. So we advise that the drugs or the medication should be used regularly as prescribed by the eye doctor. Then secondly, they have to attend follow-up. During the follow-up, there are certain tests that are carried out in order to ascertain whether there is a progression or not. And this includes checking of the eye pressure. So when the eye pressure is found to be high, it causes more damage to the back of the eye. So sometimes surgery is also suggested to our patients. We know that the economic situation has made anti-glaucoma drugs a little bit more burdensome for our patients. However, we sometimes suggest surgery or operation in the eye to further reduce the pressure, because it's only the pressure we can actually influence by treating the glaucoma patients. Another method of treatment includes the use of laser. But even then, in the use of laser, it is highly selective. It's not everybody every patient with glaucoma that can actually benefit from the laser treatment. Number one, we advise that persons who are 30 years and above should have routine eye examination at a credible eye hospital. 2, those with family history for glaucoma should also make themselves available at least every year. They should go for a routine eye checkup. Thirdly, those who have been diagnosed with glaucoma should be consistent in the use of their medications. It's not only when you are coming to the hospital to see the doctor that you will use your medication, but as the medication is prescribed, you have to use it religiously. And finally, we advocate that the treatment is for life. Therefore, you need to continue with it and to attend follow-up as scheduled by the eye doctor.
Well, let me ask us a question very briefly. Have you in the last 1 or 2 years checked your eyes? Or have you ever checked your eye before? If you have not done that, please do. But a quick one. Can you cover one eye and see how much the other eye is saying? And then the second eye. We should all do this very regularly. And for today, if you've noticed any difference in the way the two eyes are seeing, you need to see an ophthalmologist, and you need to do that very, very fast. All right. So we're going to go on to the second segment of this program. But before then, please remember to always get across to us on our Facebook page, on our Twitters, so that you can come across to us with your questions and your comment. Okay, so we're going to go on to watch the continuation of the drama clips on the still water.
Baba still remain blind even after seeing doctor in town?
Abil.
What did the doctor say?
The doctor said there's nothing anybody can do to make Baba see again. Not even the Oyinbo.
Sorry, eh? Sorry. Take care, hello.
Brother, why is it that Papa is not seeing me again?
Jude, I don't know.
There are about 3 people that are blind in our village. Why?
Jude, I don't know. It's only the doctor who can tell us why people go blind.
Set? I'm set.
Hey, wait for TJ.
I can't wait for TJ. I'll use the other car.
Okay, the key is on the table.
Okay, dear.
Shit! What a mess!
I will show you, you, yeah, man. I will show you. I will show you. I will show you.
I did not see the punter now.
Yeah? That's serious, oh. That's serious, oh. But it's as if you need to go for eye tests. If you can't see it, that means you have eye problem.
I don't have any problem with my sight. At least, I drove this car from Lagos to Ibadan yesterday. And the last week, I took my Oga to Calabar. What are you telling me?
TJ, let me get down.
Get down for what?
No, I'm okay. Let me get down, please. Let me get down. I said let me get down.
Why now?
It's okay, let me get down, TJ. It's okay. I am not going again. Back!
But you need to take it easy now.
TJ, back!
What are you trying
I
to
say
say?
back now. Park the car. Park! I'm not going again. Park!
Wait now.
TJ, park. I'm not going again.
How's it? Let him go back. Go market, Yari. Oh boy, I gotta look for you back. Don't mind that man, Yari.
I beg after the food don't do any for me.
My food go kill
you. You know the chop. You know the chop.
Yeah, but
I beg
there was traffic jam along the main road, ma.
And your common sense did not tell you that you should take another route.
Sorry, ma.
What is this?
Plantain, ma.
Orange. Can't you see these things are rotting?
These are fresh, ma. They are fresh plantain.
Are you blind? Take from my hand. Go on, throw these rotten things into the dustbin. Nonsense. Come here. I hope you know that as you are throwing this thing into the dustbin, that is 2,000 naira out of your salary that you are throwing into the dustbin. For my fuel and the money I gave you to buy these things. Oh, you are not happy? 5,000 naira out of your salary. Nonsense.
Look at this story. Very funny one.
Which one?
So interesting. This one now, page 4. Mr. Juku, are you sure you are alright? I mean, what is wrong with your glasses? You've changed up to 3 now.
Can I have the audit file for Renton and Co Limited?
This is it.
Okay.
These glasses, I have changed glasses like 3 times in 2 years. This one, I changed just last 2 months, and yet I can't read clearly with it.
Mr. Chuku, I advise you see an eye doctor.
Whose picture is this?
My dad's, the handsome old man. I want to glaze it and hang it. You can see I resemble my papa well.
That is how the drug for hypertension work. Before I go on the program tonight, I want to introduce one eye drug to you. This one is called Isin. It can cure any type of eye disease. Glaucoma, cataract, red eye, itching of the eye. In fact, if you are using glasses before, once you taste this, you will throw away your glasses. Another name we call it is sharp. Because if you use it, it will make your eye sharp. Before I go, this is my number. 00 469942. Listen to it again. 080 469942. You can also come to our office, number 25 Fadi Road, Nada House, Lafandi. This is the solution to your eye problem. It's in my hand. Yes, till next week.
Let me have my phone so you can go. Thank you.
Welcome back. I do hope you enjoyed the drama clips and that you have gotten 1 or 2 lessons from the segment of the film that we have just shown. This is where we're going to be drawing the curtain until another edition. I remain your host, Adepoju Feyi, on Side Ed. Thank you.